hit a van that I crashed into the side of it. I actually thought I'd broke my helmet this side, but I broke it this side.
Then you should have gone to the hospital.
I was sick at work, sat in a meeting room and literally just come from nowhere with projectile vomited all over the floor.
It's embarrassing, and I'm 28, I should be enjoying my life, and I'm literally not, so.
Do you know what? Then my primary concern is getting rid of it because it hurts so much.
OK.
Hospital waiting lists are long, and in some cases getting longer. That does have a backwards effect into general practice. We are trying to deal with people and cases and conditions that we've never had to deal with before because they would have been seen by specialists.
It is a huge challenge. At times it can feel really demoralising, and the stresses being put on the system is really difficult to handle. What keeps me sane is my colleagues. The nice thing about working with doctors from different parts of the country is there's lots of sharing of good ideas, solving the problem that is inevitably a national problem, and trying to make sure that we still deliver the best care.
Hiya.
Hello.
How are you?
Exciting, isn't it? You don't normally get all this.
Yeah, he was in Dr. Ferdinand in room 1. If you just take a seat, he'll be out for you shortly.
No problem.
Thank you so much.
I'm so happy you're all doing this because I wouldn't have been able to be seen for another 6 months. Oh my God, it's like having Christmas, seriously.
Hello, Miss
Hello,
Barry.
yes.
Come on in.
Oh God. I'm scared.
Have a seat there. How is it I can help you today?
Well, I have this finger and this finger.
Yeah.
It's trigger finger is what it's called. I had it 14 years ago with these two.
Right.
And I had the operation there and there. I had
Okay.
the operation, and it's been perfect. But now about 4 years ago, it started again on this, and the pain. It's like burning sensation here.
Okay.
On both sides, and I have to keep getting cold things to just stop the burning. You know.
Okay. Do you mind if I have a quick look at your
Yes,
hands?
absolutely.
And did you have any treatment prior to having the operation?
Yes, I had the steroid
You had steroid
injections.
So it's this forefinger here,
Yes,
isn't it? So
it is,
yeah,
yeah.
I can feel the little nodule on your tendon,
Yeah,
which is what's
yeah.
getting
I
caught
know, yeah.
each time. And then it's the middle
And
finger
it's the
on this
middle
one?
finger, yes, as well. Yes.
Yeah, I can feel it on that one as well.
Yeah.
So the steroid injection just aims to reduce that swelling on the tendon.
Okay.
Okay, so what we're going to do is I'm going to spray this on first.
Okay. Oh, your hands are freezing.
My hands are freezing.
Yeah, your hands are freezing.
There you go. We'll just let this sit on there for a sec. So if you just sit still there for a moment, I'm going to get the injections ready.
I don't think there's anybody in my family that's ever had this. I think
No.
I'm the only one. I think I'm unique.
Well, I think it's is more common in people who have jobs where they use their hands a lot. So
Yeah.
if that's you, right, so you should get you to put your hands on there. So yeah, bring the chair forward.
Which one do you want first?
Whichever one you want me to do first. It might be easier to go with this
Eeny,
one.
meeny, miny, mo.
Just because I think it's...
Okay.
Even with the spray that we've
I know,
used,
it's
it's
still
still gonna
going to
you're
be-
still gonna feel it.
Yes, I know. Yes.
So,
Don't worry. Yes.
Okay. Try and keep your hand nice and still for me. Well done. One down.
Wow. Wasn't too bad.
Isn't too bad. Okay, we're going to swap seats.
Okay.
Yeah. There you go.
I'm just so grateful to have it done. Thank you.
Well, that's my pleasure.
Really.
Same again.
Okay.
Middle finger this time.
Yeah.
Yeah, there you go. Just checking. Just need to move your finger a little bit. There you go. Well done. There you go.
This actually wasn't as bad as the other one.
There you go.
Oh, how is that done? Oh, bless
There you go. Have you got any questions for me?
No, none
Right,
at all. Thank
okay.
you. I'm just. Thank you so much for being.
No problem.
For doing it so good. Very nice to meet you, Doctor. I will pray for you tonight.
Oh, that's very kind. Thank you.
Thank you.
Bye-bye.
Wow.
Thank you so much.
Hallelujah.
Have you had a nice weekend?
I got knocked off my bike.
Oh no!
So I'm here, yeah.
Oh my goodness.
Saturday, yeah, me and my brother. I mean, he's coming in a bit. He's really
Right.
cut up and bruised. He's
Is he?
I hit my head off the van, so it's my neck.
Oh my goodness.
Oh yeah.
Come through, Daniel.
Yeah, you're right there.
Good
Cheers
morning.
anyway, guys. Thank you.
No.
Thank you.
Daniel, I'm Dr. Razak, one of the doctors.
Oh yeah.
You're a bit stiff today.
Yes.
What's happened? What can I do for you today?
I hit a van on Saturday.
Okay.
I crashed into the side of it, so I hit him with my helmet this side.
So you were on a motorbike?
No, cycling.
Cycling? Okay.
Yeah, but I hit him at 23 mile an hour, so it's still pretty quick.
Yeah. Did you lose any consciousness?
No.
And so today, what's left of the symptoms?
It's the base of my neck here.
Yeah.
I mean, this shoulder hurts.
Yeah, that's why you're not moving your head much.
It's if I go off centre, like, honestly, when I lie down, I can't, to get back up, I was like,
So when it first happened, the headaches were where? All over?
More fuzzy towards my left, I'd say, because I actually thought I'd broke my helmet this side, but I broke it this side.
So it was significant enough to...
Yeah, it broke my helmet, yeah.
Daniel, you should have gone to the hospital.
So what did you have done here?
Oh, I had a car accident when I was 5.
Really?
Yeah.
I've got a badly damaged left leg.
Right.
I had a motorbike accident when I was 21.
What did you? I went face down under the car.
Can you still remember it, or?
Not really, no. I remember the sensation of my nose being squashed.
Yeah.
If you're able, do you want to talk me through what happened in the accident?
It was just like I was wearing the seatbelt, and because of the seatbelt, I got hurt from my shoulder.
I got knocked over at 6, 1951. There wasn't a lot of traffic on the road then.
You probably should never ask a patient about a recent car accident before checking their blood pressure.
Let me have a good look at you. Firstly, let me check your blood pressure. Take your hoodie off, because I'm going to have a good look at your neck and things. Do you normally cycle to work? Or
No,
do you cycle for fun?
yeah, well, we race, me and my brother, so...
You guys are serious cyclists?
Yeah.
So not the occasional...
No, we do about 200 miles a week plus.
My goodness! Yeah. That's crazy. When did you start racing?
2016, we used to race motorbikes, and then because they were dangerous, we pulled onto so don't bode well, yeah, but yeah.
I think that's probably a little bit high. It's still within the normal range.
Yeah.
Given that you're in pain. Can I just lift this up? I wanted to have a good look at your spine. Can you stand up for me?
Yeah.
Just turned around. So put your hands down. Any pains when I'm prodding?
No, it's not, no.
Can you look up for me? Look up for me. Is that causing you lots of pain?
Yeah, it's getting tight, yeah.
You can tell the muscles here are nice and soft. This bit here is so tense. Yeah. So there's a huge muscle here called the trapezius. It attaches there, and it's the big triangle. This is mega tense. Are you able to put chin to chest? Try and look down. That's causing you pain.
Yeah, that hurts.
Now look up straight at me. Make a fist. I'm going to try and push it down. That's painful. Pull me towards you. When you do that, where is it most painful? All around you?
Yeah, going up there.
So can you just sit down for me? I'll just cover this eye just very loosely, right? The reason why I'm doing all this, I'm worried about if you've got anything significant in the head, okay? A lot of people like Daniel would actually do a self-assessment after a collision, thinking that if they can walk, talk and move their arms, they're okay. However, people who have significant injuries to the head and neck are at risk of bleeding in the brain, and that could be immediate or that could be slightly delayed. So untreated, it could be fatal. Your facial nerves are working well. I'm happy with that. Spine itself is non-tender. The most tender bit here today is this left trapezius, this big muscle. I'm going to up the ibuprofen to something called naproxen.
Okay.
It's a stronger anti-inflammatory tablet. Hopefully that'll bring down the inflammation. So let's see how you get on. If you're no better with the painkillers, 48 hours, ring us back. Or if you're worried about anything, any nasty things with headaches, vision, things like this, anything in the head and neck region, take yourself to A&E. The main thing to do is to still move in those directions, because otherwise the muscle will stiffen up.
As far as I possibly can as such. Okay, yeah.
Any questions at all?
No, that's fine, yeah.
Stay off 2 wheels.
Yeah, I will.
Not in the winter, Daniel. Summer's fine. Okay,
thank you very much.
You take care. Bye-bye.
Cheers.
Mrs. Steers. Hello. Hi, come on through. My name's Dr. Gray. Nice to meet you. Come and have a seat.
Thank you.
Are you her daughter? Lovely.
Yeah.
Fantastic. Thanks. Come and have a seat. I've just been catching up on your notes, but I wonder if you could just tell me in your own words what's been going on.
I think it started just over 2 weeks ago on Monday. I had a little bit of pain on the spleen. I saw a doctor. She examined me. She said, but I can't tell you what's wrong. All I can advise you to do if it gets worse is A&E.
The spleen is a really important organ for fighting infections or certain types of infections, and also it mops up any used or damaged blood cells. Carol came to see us initially with unexplained pain in the left side of her abdomen. She ended up in A&E because the pain got worse, had some more tests, and then was told she has an infarct in her spleen, which is a bit like a heart attack of the spleen, where a blockage in the blood supply to the spleen has happened. And how's the pain?
It's pretty good. When I'm standing here now, it's fine. Take a deep breath, but I've still got a little niggle down here. But apparently, I mean, you do, don't you, when you haven't got answers, Googled, and the spleen can swell, and for some time now, I'm never hungry, I don't want food.
And how long has that been going on for?
That's a while. That is a while.
Okay. And what about your weight? Is it going up or down?
Down, just like that.
Okay.
I've probably lost about a stone in 6 months, maybe. Okay. Not rapid.
And has that worried you?
No. I mean, some days I might only have 500 calories, you see. I don't have a breakfast. I have a meal at lunchtime. Don't always finish that, and then I don't want anything at night.
So I think there are two main things to sort of address today. One is this question of this splenic infarct on the CT and this pain you have here, but also this loss of appetite and weight loss, and they may be completely separate things, or they may well be connected. We have a copy of the CT scan report. It definitely puts the changes that they've seen on your spleen. They've put splenic infarct as the most likely, but it's not the only one. It's not a totally done deal that was the cause of it. They've found basically a sign of inflammation on the spleen, which is quite unusual. There's no suggestion there's any sinister causes here, like cancer. Was there anything that was kind of on your mind about this or worrying you that you wanted to talk about?
Me personally, is I don't want this happening again. How likely is it to happen again? Is it like a heart attack or... I don't know. I don't know.
And to answer that, we really need to get to the bottom of what the underlying cause was.
Hello, Adam.
Yeah. Thank you.
You take a seat.
Thank you.
Morning, Adam. Adam, I'm Dr. Razak.
Yep.
What can I do for you today?
I think you saw my brother earlier, and we were cycling, I kind of got knocked off my bike. But I think if I show you kind of my injuries...
Yeah.
My main one really is
this, yes.
This.
I can see that because, you know, soon after, did you clean it or not?
Yeah.
Because there's obviously, it's all gravel and things, isn't it?
Yeah. I mean,
and you can see that it's getting red and infected around the area. Can you see?
The whole thing is kind of bruised and swollen. And then I've got some up here and up here that I could show you.
I'll have a good look. I think it's best, so in order to assess your hip and your back, I need you in your box assist. Are you happy with that?
Yeah, that's fine.
Yeah, okay. Let's just strip. Is your back okay?
Yeah, my back's fine.
And you're able to touch your
No,
toes?
I'm not. To lift my leg is a problem, but I can, because this is mainly where it hit me.
Okay. Because the one on the leg, I think that is soft tissue. We can get that sorted out.
I mean,
Gosh, that's significant, isn't it?
That's where it was. I mean, that's really tender. Oh yeah.
You think you'll be able to get on here?
Yeah, I can't see why not. It's just mainly, this is what I'm saying, they're getting that lift in my leg.
Yeah.
I mean, this side isn't that much of an issue.
Okay. Can you, locking your knees, try and lift this leg straight up to the sky? That is okay?
Yeah.
Okay, now I'm going to pull it out.
Yeah, I mean, it's kind of, a little bit, but...
Not as bad as the other side.
No.
Try and lift this leg up. So that's all swollen as well.
It's a lot of effort. It just feels heavy.
Out again. You know, I'm a bit worried about that side.
I mean, this was the main impact side.
So this one, I can sort this out. I can give you 2 lots of antibiotics.
Yeah.
You know, 1 to swallow, 1 to apply on all the grazers. I don't know whether you've done something significant here. So this is soft tissue, but this is really tender.
Yeah.
I think you need an X-ray. I'm going to have to send you to A&E for this one.
Yeah.
Just to be sure. A typical broken hip is you're not able to put your weight on it. But I'm just worried the fact that you're on a bike. Let's get you up so we can... Are you able to... You sure? Let me just pass you this one. Painkillers wise, Adam, and antibiotics. At the moment, what are you taking? Painkillers?
Yeah, I borrowed some off Dan, actually.
You borrowed off Dan? Yeah. Okay, I'm going to give you something similar. I'm going to give you non-steroidal, which is anti-inflammatory. Have it with food. A bit of cocodamol as well to try and ease the pain. I'll give you some antibiotics, but you need to go to A&E for that one because I think just to be sure, you're fit, healthy and well. You race competitively. We don't want to miss any little chips and whatnot. Patients are hesitant to go to A&E because of the long waiting list, and sometimes they feel that perhaps their condition it's not serious enough to warrant an urgent assessment. Some of them feel guilty about clogging up the system that's already very busy. In a young competitive athlete like Adam, even the slightest injury to his hip would affect his quality of life long term. So that's why I urged and advised him to go to A&E.
Yeah. Okay, good stuff. Right. Thank you very much. Thank you for your time.
You're banned from bikes for a good while. Is this your off-season anyway, is it?
Yeah, it's finished now.
Okay.
Thank you very much.
No worries.
Thank you.
No worries. Have a good day.
And you.
So it may be that we pick up this conversation on the phone later today after I've had a chance to speak to the team at Good Hope to work out between us what we think the best next tests are and how and where those are done. Carol was told she has a splenic infarct, and when we're looking at causes of this, we're looking at really causes of blood clots that are flying around the system and blocking up arteries. A splenic infarct, a small one like Carol has had, is not going to be life-threatening in and of itself, but in her case, we really want to understand what the underlying cause is. For example, if she'd be at risk of stroke. Separately or possibly connected, I do think you need some more investigations about this weight loss. But it might be that you need a camera test into the stomach to work out why you're getting that early fullness and some different bloods added on.
But it's not drastic weight loss, it's very slow. I mean, ounces a week.
Yeah. Mum, you've always been a big lady and you've never lost an enormous amount. You've been on sort of yo-yo diets, if you like.
Of course.
and you've never really sort of lost much ever, have you?
No.
So, you know, let's put things into perspective.
But then if you're only eating one meal a day, you are going to lose weight.
You are going to lose weight. I suppose the main question is why is your appetite? Why is your appetite down?
Yeah.
We do need to look into it. But we are going to look at, you know, all these tests will be to understand those two things and see if they're two things that are separate or if they're in some way connected.
Thank you for your time.
Thank you very much. Not at all. Nice to meet you both. Take care.
After you, Mum.
Bye-bye.
Bye-bye.
Thank you so much. Thanks a lot.
Bye-bye.
Thank you so much.
Thank you.
Thanks
a lot. Take care.
Just get the door on the left.
All right, see you later.
See you later.
Bye.
Janet?
Oh, hello.
Hi,
Sorry.
good morning. Oh, good afternoon, nearly now.
All right.
Come on through.
All right.
We've got enough room there.
Just about. I'm a big girl.
Come and take a seat. My name is Dr. Rafi. Thank you for waiting for me.
It's quite all right.
You're all right there.
We're down, yeah.
How can we help today?
What is it? I've got like a lump or a swelling under my armpit on the left-hand side. And also my left breast feels really like heavy.
Right.
And my nipple feels really sore.
Right.
My sister's had breast cancer.
Right.
My youngest sister and my mum's sister.
Okay.
So any sort of lumps and bumps I like to sort of...
Be extra wary
Yeah.
about. Completely understandable. So when did you notice the lump?
It's really not about 3 or 4 months ago under my arm.
Yeah, the
But
lump
then
of
this has
your
gradually started getting as if it's really heavy.
And any changes over the skin of the breast that you've noticed?
No.
Have you been for breast screening regularly?
The last one was like 3
Was the
years
last
ago.
one
yeah.
3 years ago? Okay. What we will need to do is examine under both arms and examine both breasts. Do you mind a male doctor doing the examination?
No,
I am going to ask a chaperone to come in. Okay.
Yeah, that's fine.
Try and get your arm relaxed as you can.
It's a bit further forward.
Okay, no worries, that's fine. I'll just check at the back and then I'll come forward. Okay, it's even smaller than the tip of my finger, though.
Yeah,
I
it
can
is quite
feel.
small.
Yeah? And then just relax your hand now. Okie dokie. Right, I'll let you get things back together, okay? Just give us a shout if you need a hand, though. We're just behind the curtain, okay?
Okay, thanks.
All right, Janet, take care.
Okay, thank you.
Thank you, too. Right. I'll let you catch your breath a second. In terms of your examination, nothing for me to straight away suggest to you that there's anything sinister going on, really. You're right to make the connection in terms of lumps under the arm. You know, it's the glands that come from the breast that go underneath the arm, and that was always make us worried and concerned. There was that little bit of pain when we were examining you as well, but there was no obvious lumps over the breast. But you're right that we need to be thinking about ruling out cancer for you. And therefore, the urgent breast cancer suspicions pathway is the pathway that would send you down rather than the screening.
Oh, right.
You'll get a letter through saying you've been referred to the urgent breast cancer clinic.
Yeah.
So at least you know to expect that.
Yeah, fine.
But is there anything that was playing on your mind or anything that you wanted to...
It was my throat.
All right, okay.
I've got 2 cysts apparently down my throat. This is
Right.
go back some time ago. And he said that was fine, but if they get any bigger, or they bother you. But when I start talking, I'm trying not to, it starts going croaky.
Right, okay.
And I was just thinking, have they got bigger, or... I'm a very lumpy person, I've got a cyst on my ovary as well.
Lumpy person,
So
I like
have
that description. All righty. Do you want me to have a quick look at the throat and...
Yeah.
Right, let's go for this one then. So, just open your mouth nice and wide for me, stick your tongue all the way out, and then now a nice big R. Okay. When did you last see the ear, nose and throat people?
It's a long time ago.
All righty, that's fine. There's nothing obvious for me to see there. By the sounds of it, it's probably further down where they saw the issue rather than high up where I can see it. Which means that you know, to get a proper look at it, it would be back to the ear, nose and throat people anyway.
Thank you very much for your help. Okay. That's wonderful, thank you.
Thank you for coming to see me.
Right, thank you very much for your help.
All right, you take care.
Okay, bye-bye. Ooh. Ooh, shocks. Okay, bye.
See ya.
Hello, you alright?
Hiya.
Hello, we've got everybody today.
Yeah, Brooke got me today.
Amazing, brilliant. I believe he's here to see Dr. Ferdinand today. Fab, if you'd like to take a seat.
Hi.
Hello, Miss Malone.
Hi.
Come on in.
Come on in.
How's everybody doing?
Good, thank you. How are you?
I'm good,
Hi,
thank
how are you?
Come on in. Hello.
All right.
Have a seat. Hello, young man. Right, I know we've not met before, but I've been looking through your notes and sort of looking at what's been going on. So, why don't you tell me a bit about, like, just to make sure I get it from your words.
So I've had this lump in my back for probably a couple of years now.
Okay.
Progressively getting more and more painful.
Yeah.
It was an intramuscular tumour that needed a bit more looking at.
Yeah.
Had the MRI scan and I've been to see the sarcoma specialist at the QE.
Right.
The feedback from them yesterday was that the lump was just a benign lump, but I mean the message said it needed no further follow-up, but it is horrendously painful.
Okay. The confusion here is where we use the word tumour, we often use it in relation to cancers, but obviously tumour technically can be a growth of anything. It can be a lump of anything.
Do you know what? My primary concern is getting rid of it because it hurts so much.
It's good news that it's obviously not cancerous, it's not life-threatening on that side.
But there's still a pain issue which needs to be solved.
It is getting worse as well.
Okay. There's a possibility that even if they did remove whatever it is, the question we have to make sure we answer is that whatever it is that we're feeling definitely causing the pain?
I think it is that. It's almost like it is like progressively getting worse, and it's almost like I can feel it growing. If that makes sense. And I don't know if it's that it is.
Thank you very much. I'm going to get all my helpful things, aren't I? Thank you.
I don't know if it's that it's growing and pressing on something or shifting about, or if it's, you know, got some kind of nerve involvement around there.
Okay. Would it be okay if I popped you on there and if I try to have a feel to see if I can find it, if that's okay? Right.
You want to take Theo and sit them out there
I think so.
Bit,
Yeah. Did you say bye-bye, doctor? Oh, wow.
Usually I draw a face on it, but you can just have that one. Aren't you lucky? How's the easiest way for me to be able to feel it?
See you in a moment.
Might go that way. So it's around there.
So sort of in this sort of area?
Yeah, probably down a tiny bit there-ish.
Oh yeah, so I can feel all sort of irregularity there. And so pressing on it now, does that?
I can feel when you're pressing in the right place. So it's like tender, but
there's certainly no pain when we press down the middle of your back here, is there? No. All right. Stand up again for me. Look, I think there's a pathway to go down in terms of maybe thinking about whether we might want to remove it or not. But there's still that fundamental question before it, which is it that lump that's causing the pain? I wonder if, in terms of helping us answer that question, we might refer you to a clinic called the Pain Clinic. Now, their job is to kind of understand, you know, what may be causing the pain and how that can be best managed. Between now and then, do you think there's anything that we could be doing to try and help you manage the pain more kind of day to day at the moment?
I don't know. I'm really, really struggling.
You mentioned you take some medication for it, which zones you out a bit.
Yeah, so I'm on tramadol and gabapentin.
Right, the gabapentin would be the one to try and maybe play around with and see if we can get some added benefit from that. Yeah. Okay? But definitely I think the most important thing is we'll get the pain clinic referral done.
Right, lovely, thank you.
No problem. All right, all the best.
Yeah.
I'm hoping the balloon kept them busy.
Thank you, help. There we go.
Say bye.
We quite like this.
Yeah.
Don't we?
Thank you very much. Thank you so much. Bye.
I thought that was a gin and tonic for me.
I wish it was.
That looks intriguing.
This one?
Yeah.
It's a sand timer.
What's that for? How long's that last? That sand thing?
Give me a guess. What do you reckon?
Hour and a half.
Close.
15?
Not, no.
I'm going to say about an hour.
Bit longer.
I mean, that's slightly like asking how long is a piece of string.
It's actually for 2 hours.
Really?
Yeah.
Save the record.
Oh.
Everyone okay?
You're all right.
Hi,
Hello.
come on in.
Thank you.
I'm Dr. Gray. Nice to meet
Hi.
you. Come and have a seat.
Thank you.
So how can I help today?
Oh, last week I was sick at work. Literally just sat in a meeting room and literally just come from nowhere. I was projectile vomited all over the floor. And then last night it happened again.
And anything the other end? Any diarrhea?
I had a bit of loose bowels this morning.
Okay.
I think the main concern is obviously because I'm diabetic. I can't eat. I noticed it's kind of catch-22 because you've got to eat enough food to make sure that you stabilise your blood sugars. But obviously, I'm trying to keep food down at the same time.
Do you know what your sugars are this morning?
I've not done them as yet.
Have you felt any symptoms of either being high or low?
No. It seems I've not taken any insulin as such as yet because obviously I've not had any food.
You know, when you're in this position, it's a bit of a common dilemma, but actually you still need to take your insulin in circumstances like this, and it can be a real risk with diabetics who take insulin if they don't give themselves some insulin when they're ill. And I understand why people think, oh, if I'm not eating, I don't need it. Actually, you can end up, you know, in a diabetic ketoacidosis state and end up in hospital. Diabetic ketoacidosis is a life-threatening condition in people with diabetes, essentially when their body runs out of insulin. Insulin carries sugar across your blood vessels into the tissues where you need it to use it. In diabetic ketoacidosis, you've got too much sugar in your bloodstream. That level goes up and up and up until the body starts to produce a dangerous substance called ketones, which makes basically the blood turn to acid, and people can get very sick, and it can be life-threatening. So there's two things that we really need to think about today. Why are you sick? And are you okay from your diabetes point of view? And I'm grateful you brought in a urine sample because I can have a look at whether or not you've got any ketones in your urine, which will help us to work out what to do next. Let's do your blood pressure. I'll check your urine. Do you happen to have your BM kit with you to do your sugar?
I've got it, yeah.
Would it be all right if we did that as well?
No problem.
So if you pop off your jacket, pop this through there. Just relax your arm in your lap there. Yeah, perfect, thank you. And while that's going up, I'll just check what's going on with your urine. Doesn't look like any ketones at the moment, which is good news. 132/95. I saw in a letter that they've asked if you can have a Freestyle Libre, the continuous glucose monitoring. Do you know what's happening with that, whether or not that's...
So unfortunately, because of COVID, they was stopped taking any referrals. So I'm sort of, if you like, waiting for a go-ahead for it to happen.
Martin was waiting to hear back to see if he would be eligible for something called a Freestyle Libre, which is the brand name of a particular type of glucose monitoring system. It's a very clever piece of kit that people on insulin can have, that it sticks to their arm and it's continuously giving data on what their sugar levels are. It's a really fantastic piece of kit, and for a lot of people, they've found that just having more regular updates as to your sugar levels can really help with
and I think this is the risk that because obviously this can be quite mundane.
Yeah.
Having that sort of being able to scan on your arm, you know, freely has made it a little bit a lot easier.
I'll just double check what's going on with your urine as well. See with that urine dip, it does show a high sugar in your urine, so I'm sure your level 16.2. And how often do you get readings like that?
Quite, yeah. There is an issue around management of diabetes.
And do you have any sort of ideas of what went, you know, what
I think my mental health might maybe actually be against me when I'm trying to do my diabetes regime, because it's like, I can't be bothered, or I'm not feeling it, or I've missed it out. And, you know, I'm grateful that my wife does sort of constantly remind me to take my medication and have.
I mean, we also know that people who have long-term conditions like diabetes are also more prone to having mental health problems. So as you say, it can be a vicious cycle with the right support.
You know, I'll be honest, I missed a few appointments because maybe I was afraid to go and say, look, I'm falling behind or I'm struggling with keeping up to date. You know, I didn't really want to sort of face it.
Yeah. If things are not going in the right direction with your diabetes, actually people want to help, but I know it can be difficult to say things aren't going well. But actually surrounding yourself with the support that's available gives you the best chance of getting your diabetes on track again. In terms of this vomiting that you've had, it sounds most like that you've got a stomach bug. We call it gastroenteritis. Just really making sure you're keeping on top of your fluids. And even if you are only drinking water or bits of Lucozade, just keep an eye on that blood sugar. It's one of the commonest things that we see in hospital when someone's unwell with diabetes is that misconception around needing to take insulin even though you're ill.
I'm grateful that you mentioned about the insulin because that's really going to help.
Any questions at all?
No, I think that's it.
I hope you feel better soon.
Okay, thank you very much.
And good luck with your diabetes.
Thank you very much.
All right, take care.
Thank you.
Bye-bye.
Thank you, bye.
Bye.
Hi there. I gather you've been waiting a bit. I'm sorry about that.
Yep, well, it's been a while.
Hello? Music.
Unfortunately, the waiting times for ENT in particular are very, very long.
Hello. We're still waiting for the letter at the minute.
Okay.
But
you know you're on a waiting list to get seen there.
we're on a waiting list.
Okay.
Yeah.
Oh, you're on the waiting list? I said, what do you mean I'm on the waiting list? Up to 12 months? I said, I can't wait 12 months.
No. Hello? Can you hear me?
So how long does that take normally?
Used to take a few weeks. Now I think we're looking more like a few months.
Oh, so my ear could fall off by now.
No! Did he cut me off?
Hello,
Oh,
how are you?
Yeah, good, thank you. You?
Good, thanks. Is it Jessica?
Yes.
If you just want to take a seat, she'll
Thank
be out in a
you.
minute.
Thank you.
How's your day been so far?
Yeah, busy, work.
Busy?
Yeah.
What's work?
I work in a care home, so I'm a deputy manager.
Oh, doctor's
Oh,
That's
yeah.
all right. Sorry to disturb you.
Just having a chat.
Jessica?
Yeah.
Jessica, I'm Dr. Razak.
Oh, yeah.
Tell me what I can do for you today.
So I have got the, can I say, lymphocolitis.
Yeah.
I'm still waiting to have a camera down my throat. Still waiting.
Okay.
Everyday life, I'm really struggling now. On and off the toilet. Today's 8 times.
Gosh. Are you having bleeding at all?
Yes, I'm bleeding.
Lymphocytic colitis is a type of inflammation of the gut that often manifests itself in the slightly younger population, causing them to have profuse bleeding and diarrhea with frequency. How are you energy levels?
I'm tired constantly.
Yeah.
I'm asleep by 8, 9 o'clock. Like I said, it's affecting me, everything now.
Do you have normal formed motions? Are your motions ever
it
solid?
It can be soft.
Yeah.
But then it can be, sometimes I'll go for a wee.
Yeah.
And I'm having my bowels open and I didn't think like I'm even needed to go to bowels open. So it's even going to a public place, like tomorrow I'm going to the head office. And I'm worried about doing that because there's only one toilet there. So it's literally getting to the point where I'm petrified to go anywhere.
It's like when you go out and there's no public toilets and things, and they're not very nice to use.
No, that's what I mean. And if I'm
Yeah.
and it's just, it's embarrassing. And I'm 28, I should be enjoying my life, and I'm literally not.
100%.
So.
I was just looking, because obviously the management of colitis is normally secondary case specialists.
Yeah.
It is very difficult because our hands are almost tied. A lot of the medication they give normally needs to be initiated by specialists. Given that we can't give you much else.
I just need something because I just can't get through. I can't do it anymore.
Okay. Let me just get a second opinion because
Okay.
they are very. These are normally secondary care drugs, but at the same time, I know the waiting times are long.
Yeah, I
and I
can't
just
wait.
don't want to. You know, it's really impacting. Give me 2 minutes and I'll be back.
Thank you so much.
I need a second opinion from Aftab.
Hello.
Aftab, I need a second opinion. I have got a 28-year-old young lady, had a colonoscopy. It's proven lymphocytic colitis, they call it. So it's a type of colitis.
Yeah.
She's still going about 8-9 times bloody diarrhea.
So I personally would do bloods on her, see what the status is from that point.
She's really desperate for something today, though. I do sympathise with Jessica. She's a young lady trying to get on with her life, and I felt that perhaps we could do something quicker for her. When it gets to specialist conditions, we do not have the expertise nor the knowledge to start treatments. Similarly, how you would not expect your GP to do chemotherapy, for example. You would not expect your GP to start patients on tricky drugs that require monitoring and titrating. I was just chatting to the other GP, and then he agrees. Things like steroids and whatnot, Jessica, is a bit crazy. We don't even know how much, how we're going to monitor you and things like that. But I think the main thing is to try and chase this up because I'll get that done. I can see how frustrated it is.
Yeah, I am. It's just,
I feel really... But let's get bloods done.
How long do you think the wait's going to be?
This is the thing, it's a hospital thing, but I will make sure I'll
because
send
obviously when I had the camera before that, it was like done in what, two weeks, so I thought it'd be quite quick again, but
the 2 weeks, the 2 weeks are normally to exclude cancer.
Yeah, so because it's not now, it's just gonna...
And that's the thing, but I will sell your case. I can see how frustrated, how it's impacting on your whole life, but you're doing grand, honestly.
Yeah, I don't feel,
Okay.
Yeah, lovely.
Right,
Thank you so much for your help. I really appreciate it. Thank you.
Thank you, see ya.
Thank you, see ya.
Poor thing. So bad for her.
Hello.
How are you?
I'm good. So your patient then are they?
Yeah. So I think this is a theme: frustrated patients waiting for hospital appointments, and they keep coming back to us.
They do.
I feel really bad for her.
Yeah.
I'm just in
and that's the thing. There's a person in the middle of all of this.
Yeah. Managing patients' expectations in the post-COVID era is very tricky. You want to do the best for your patient, but we are faced with the challenges of limited resources, a very long secondary care waiting list, and also complex medical problems that perhaps have been sidelined during the pandemic.
We will always be, and always historically have been, full to the brim in terms of appointments. But it's how we deal with that demand with the COVID pandemic. We moved from face-to-face consultations to doing telephone consultations almost overnight. But we've got to move with the time. We've got to remain flexible and adaptable.
This awful scabby places on my collarbones.
Yeah.
And I'm a bit worried they may be cancerous.
I get a lot of pain in all my body. I'm finding it difficult to get around, and I didn't used to.
Is there anything else I can do for you?
Yes, can you lose me a 5 stone?
If I could do that, I would be sat here, would I?
A new GP's Behind Closed Doors is back next Tuesday at 7. And if you or someone you know has been affected by any of the issues raised in tonight's programme, please go to channel5.com/helplines for information and support. A sweet little Italian greyhound who just can't bear to be alone makes his feelings known loudly. Graham may need some earplugs in new dogs behaving very badly. After the break.